So we are delighted to take some questions from you now, and we have some helpers out in the audience who have microphones. And so what we'll ask is if you have a question, I'll try to identify you as the next speaker, and then if you will look for the person with the microphone so that everyone can hear you. So while we do that, I just want to thank our three speakers for a wonderful program. And one of the things that they helped me understand as we were preparing for tonight is that the things that we do to make healthcare environments better and safer and more comfortable and friendly for older patients really helps all of us. And I think that is something that we want everyone in our community to understand as we go forward. So with that, I think this gentleman over here has a question. Courtney?
I had a question for Dr. Tingwald. On the public spaces, I noticed a lot of glass, and if you have the hard surfaces, how do you keep the sound down with the glass and with the floors?
Well, there's lots of ways to do that, and some of it is in the selection of the materials that we provide. The flooring materials may be a very washable and non-slip surface, but it may not be the same. It certainly won't be the same sort of things you've seen in the past. We have green initiatives of what kind of materials we can use for these things, et cetera. And then we will be looking at ways to mitigate those sound issues. If you looked at the slide and you saw the curving ceiling within that public space, our designer for the hospital, Raphael Vignoli, has recently completed the concert hall, the Kimmel Center in Philadelphia for the Philadelphia Orchestra. These are designers who know acoustics and know how to deal with these kind of problems. We want to provide that glass for visibility to nature, for the bringing in of natural light, et cetera. And we understand what sort of sound mitigation issues we have to deal with.
Gentleman over here at the end.
By far, the biggest fear that I have of hospitals is the recent articles that I've been reading about superbugs. Are those provided for in the design in any way, or is that a purely operational issue like scrubbing and so on?
Dr. Tingwald?
Well, MRSA and the other, again, we talked a little bit about the big word nosocomial infections. These are things that are handled in the design process as well as certainly through medication, et cetera. But cleanable surfaces, how we deal with hand washing, and how we deal with separation of rooms so that we're not spreading infection from one patient to the other. Again, another really strong point for private patient rooms is that we are not spreading infection from one patient to the other in the same room. But as nurses leave that room and physicians and go to another room, we have hand washing and other services between each room. So it's completely changing the nature of how we provide health care. It means that we have longer travel distances for our nurses and physicians, but it means it's a safer environment for the patients.
This lady in the front row right here.
I'm confused about the bathroom with the shower not having the raised little wall. Does the whole floor get filled with water when you walk out of the shower and go to the sink? Is it all wet?
Yes, it is. No, I think the issue, first of all, this type of shower has been used in hospitals in the United States for about 15 years now. And it has been proven to be a very safe environment. The first thing to know is that there aren't that many patients taking showers in the hospital anymore. As many people say, if you can get up and take a shower, you're home already anyway.
Be careful.
So the times that the floor would be wet are minimal. The other thing is, once that floor is wet in a shower situation, nurses have learned how to deal with putting towels and other devices on the floor, how to make sure usually a patient is in that room supervised. And really we've actually seen a greater decrease in falls and other services with this kind, even with the wet floor, than we have from people tripping over the lips and other things in the floor environment.
Betsy, would you like to comment on that also?
I would, thank you. Very often we have what we call shower chairs or benches so that people have a place to sit. This is particularly good for older people. And if you're in the hospital, the chances are that you're there for a pretty good reason. And your ability to stand up for a long time is somewhat less than it might be. But the way the floors are sloped, the whole floor usually does not get wet. It's just most of the showers are in about a 3 by 5 space. They do have shower curtains, so you can pull it across for privacy and that sort of thing. There are grab bars and a place to sit if you need to sit down. But because the floors have been sloped, usually the water doesn't go out very much from that. But it's designed, the biggest reason that we want to do it that way is so that we can eliminate the thresholds, because a lot of people can't see them. A lot of people forget that they're there. And as I said before, it isn't so much a problem of how high the threshold is, it's that it's there at all. And a lot of times we don't tend to pick up our feet as much. We just kind of slide along to stay in contact with the floor. And so the threshold can trigger falls. And this has been much safer. We've had a much better safety record with this.
Question back here on the right.
Just about the thresholds, I'm wondering how many of us have tripped on the concrete threshold in parking lots.
Could you speak into the mic,
Yes.
please? Thank you.
Yes, if I can, if I know. Did I miss something in the picture of the room? I saw no window, and it looked as if over the dresser or the bureau, it looked like it was almost a painting as in a hotel.
The image of the room was actually, because of the shot, how it's photographed. The model, you're looking from the window into the room. Each patient room, well, first, all patient rooms have to have windows now, just by code issues. We have very large windows in these patient rooms. And in the plan you saw, if you remember, there's a window seat, and the window is above it. That window seat is long enough for sleeping, so it's about 7 feet. So we have very generous windows within each patient room, and they will have the best views of any rooms in Palo Alto, being as high up as they will be. So they will have spectacular views. The thing that looked like a painting on a wall is a very large flat screen television set. And that level of technology is something we're seeing not only in home environments, but in hospital environments. On that kind of screen, you will be able not only to see the menu to order your meals, you may be able to review x-rays with your physician on that screen, as well as watch movies and do other things, or video conference with your family anywhere in the world. So that is a really important piece of what technology is allowing us to bring into the new hospital setting.
Is it not also the case that the rooms will have individual shutter control so that the patient in each room can adjust the outside shutters?
Right now, we're working on the exterior design of the building right now. And of course, in this environment, we have to deal with not only the great view you may have from the room, but how much sunlight can actually come in. And we're looking at how to do that in a environmentally sensitive way with screening devices, et cetera. And that piece of design is going on right now. What we will be required to do is handle daylighting to respond to green environmental initiatives.